or good afternoon, as the case may be. Welcome to our webinar on the unstoppable forces in MedTech in Latin America. My name is Ared Delgado. I'm the Digital Marketing Director for Global Health Intelligence, and I'm going to be serving as the moderator for today's webinar. So before we get started, we just want to give you a little explanation of what to expect in this particular webinar. We're going to have a presentation that lasts around 45 minutes, and after then we'll address any questions that you may have. Now, you can ask questions at any point in time. You don't have to wait until the end of the webinar to do so. The way you do it is if you look at your participant panel, you're going to see a series of icons, and one will say Q&A. So if you click on the one that says Q&A, it'll bring up a window. You can type in your question and send it on over to us, and then we'll address your questions at the end of the webinar. So as they occur to you, by all means, fire away with questions. We're happy to answer whatever questions that we can. We also may ask you a couple of questions during the course of this webinar. We have poll questions, so you'll see those come up in due time. And those poll questions are basically focused on just us understanding more about what you're interested in so that we can then tailor our webinars to suit your interests. One of the questions we always get from folks when they attend our webinars is if the materials are going to be available after. So let me answer that now. Yes, the answer is yes. We'll definitely send the materials to you within a couple of days. Usually what we send along is going to be a PowerPoint and a video. So that's basically it. Now, you may notice a cover up here, of course, on the main screen, and that is a report that we just put out. It is a fee-based report, and that really it covers a lot of market data for the industry. And in fact, the data from that report is what we're using to fuel this webinar presentation today and let you know a little bit about it. And we'll talk to you a little bit more about that, the white paper, that particular report, I'm sorry, later on in the webinar. All right, so let's move on here. As you can see, this is our agenda for today. We're going to start off with the unstoppable forces. So these are kinds of forces that are happening in the marketplace that are changing things as far as the landscape for the medical equipment MedTech market in Latin America. And then we're going to get into more specifics with the next section of the webinar that's going to talk about hospital technology leaders and the landscape in general. And then finally, we're going to get into 6 winning strategies for sales and marketing teams that they can apply to their efforts, so to speak, to try to improve at their sales and their marketing efforts based on the data that we're seeing here today. So that's the basic agenda. Then at the bottom there, you're going to see the legal notice, and that's something you can read at your leisure. I'm not going to read it out now because it'll just take time away from the actual presentation, but it covers liability and the information that we're sharing today. So we certainly encourage you to look at that when you have a moment. Now, moving on, this is going to give you a hint of who our speakers are going to be for today. I'm over there on the left. We're also going to be joined by our project manager, Christophe Leroy, and also by the CEO of Global Health Intelligence, Guillaume Corpart. So they're going to be your panelists for today. All right. This is a little bit about us, because how do we get this knowledge to basically share it with you in the first place? Well, this is because we studied the hospital landscape in Latin America. In fact, we've been studying the hospital market in Latin America in terms of MedTech and medical equipment and such for the past 10 years. So over the course of that time, we've gotten primary research done with hospitals, specifically getting the information directly from them as opposed to secondhand sources or something like that. And that's something that we use to provide our clients with that market data to help them improve their sales and marketing efforts. So a lot of what we do on a regular basis is help clients with market sizing, market landscapes, understand the market size, for example, for a particular equipment category or a particular device category, depending on the country that we're talking about in Latin America. And our coverage is, of course, all of Latin America, about 19,000 hospitals in a database that we have with the data. And of course, we've done studies about specific markets as well, custom studies. So it's a lot of the stuff that we do. We also work on surgical procedure volumes, because that helps clients extrapolate the need and demand for their products based on types of surgery that are being done. And this is a sense of what we do. And this is how the data that that's how we got the data that went into the report today. All right, so let's move on here into unpacking the unstoppable forces. I'm going to turn the floor over now to our next speaker to talk a little bit about that. So Christophe, I think, is going to lead us off in this discussion. Christophe.
Thanks, Abel. It's a pleasure to be here. If we could just go back to the last slide for a moment, I wanted to give some context. We want to start off this discussion today with a perspective on what we're calling unstoppable forces. In other words, what are not just trends, but major drivers that are affecting various aspects of society and the economy, and therefore also the healthcare space. And the reason we believe it's important to start here is, as you'll see with the topics we'll be discussing, these are such important forces that it's the equivalent of the tides. When the rising tide comes, it lifts all boats, including specific ones such as medical devices, pharma, and other aspects of the healthcare industry. So we're going to take you through three major forces that we think are reshaping the healthcare landscape. And now we'll start with the next slide, talking about the impact of demographics. So the first thing we want to share with you is the impact of population growth. We know that the global population will surpass 9 billion in just a few years. That is a significant number, but that doesn't tell the whole story. What we want to draw your attention to is that this growth is not equally distributed across the globe. And in fact, Latin America stands out as one of the regions where population growth is quite significant. And that has a lot of impact on the economy, on various sectors, but also on healthcare. Another note before we move on is population growth in places like China is not going to be as strong in the coming years. And in other regions, such as Europe and North America, growth is stalling. It hasn't been eclipsed completely, but it is stalling. So really, Latin America actually stands out in this regard. And on the next slide, we're going to see some of the implications of this growth. What we've done is we've taken a look at how population growth is distributed across different stages of life. And this is a story that we think is important to tell. You'll see on the left-hand side that the younger age groups have seen a significant drop over the course of 10 years between 2010 and 2020. There has been a significant demographic shift across the region, and the population is aging. It's not just aging, it's aging fast. Look at the growth of seniors, 51% over a 10-year period. This has significant impact. So think about all the different products and services geared towards children and teenagers that will be affected. Everything from caregiving, clothing, but also preschool. And when we think about healthcare, the different services, including pediatrics, that are geared towards younger citizens. By the same token, consider the implications of a fast aging population and a certain category of services that are going to see a lot of demand. Everything from investment to private financial planning, wellness services, certain types of travel, and of course, all the healthcare expenditures related to old age, including various types of procedures, but also home care, hospice care, and certain types of hospital care. So we think that this is a significant, not just a trend, but a significant force that is reshaping the market, and one that we all need to pay attention to. Now, if this were the only one, then that would be okay. But it's not the only force. So I'm going to hand it over to you, Guillaume, to talk about some of the other dynamics in the market that we need to look out for.
Brilliant. Thank you, Christophe, and thank you everyone for being here with us today. So another unstoppable force is our ability to generate content. And that has never been more true than since 2023 with the advent and incursion of artificial intelligence into our everyday lives. So I'm going to take you down a trip down memory lane right now, and I'm going to think back of my college days back in the 1990s. Because in the 1990s, we were starting to talk about, computers and our drives and our content creation, and we were measuring it in terms of megabytes. At the time when we're talking about big data, we're talking about terabytes of data, and it was mostly focused around banking information and store receipts and the like. Now, as we approached the late 90s, we saw a shift, and more people started creating files, right? So we had users empowered to create files through Excel, through PowerPoints and Word documents and the like. Now, in the 2000s, in the early 2000s, we saw the introduction of social media, initially with Facebook, but then into Twitter, and more recently in TikTok and Instagram and all of those. And what each one of these technology advances brought along was more and more content creation, user-based content creation. In the early 2010s, we saw something completely different, which was the introduction of streaming platforms such as Netflix. And at one point, it was said that about 30% of all the online streaming that was done was owned by Netflix only. I mean, that's how much content generation came about. At a similar time, we were also talking about the Internet of Things, when our cars were starting to become online, our refrigerators were online, our alarm systems were online, and all of that adds to content creation. But really nothing reaches as much content creation as does artificial intelligence. And so what we've seen since 2023, the launch of ChatGPT, is a huge shift in the ability to generate content, but also process data. And that's really a key factor both in the healthcare field and also the injunction of AI. It's the ability to process data. So we can think about all the medical devices that are coming online, whether they're CT scanners, imaging equipment, heart monitors, or even our smartphones and our watches that gather our pulse every day and so on and so forth. AI now has not only the ability to generate more data and more content, but also process all that data, all that healthcare data that users are gathering. And that's critical because AI is at the center of another unstoppable force. So if we could move to the next slide, please. Everyone here has likely lived through at least one major disruption in their lifetimes. And some of us here, those with more gray hair, have probably lived through several. And what's interesting is that all of these disruptions that we've lived through, at least all the recent ones, have one central element in common, which is digitization. So data has to be digitized in order to be scaled. And that's critical because scaling enables disruption. Without scale, we simply cannot hit disruption. Now, the second phase of the 6Ds of disruption is the element of deception. So I'm going to take you back down memory lane one more time as we think back of the internet and the importance of deception within the disruption model. You may recall that in the late 90s, it was the internet boom. There were plenty of companies out there that were launching their sites, but there was really no coherent or cohesive effort in terms of where the internet was going. Some folks were talking about the internet services or banking services being online, or people buying their groceries online or buying their shoes online. And others were saying that that was completely ridiculous and we would never get there. Yet we did. And what happened was in the early 2000s, we had the IT bubble and the bubble burst. And when that happened, we had companies like Cisco come out and Google and really own the backbone of the internet and push it forward. So we weeded out all the fly-by-night companies and concentrated the efforts on growing the powers of the internet. Fast forward 20 years, we can't think of banking without online banking. We can't think of purchasing without online purchasing of a lot of products. And when the internet falls, it feels like our life is stalled. And so I want to just bring you back to those moments of deception in the early stages of internet, because that's a little bit where we are here today with AI. A lot of folks are talking about where is AI within healthcare? There's no tangible aspects just yet. And that's correct. There might be some incipient aspects, but let's give it a year or two and see where it takes us, because that's really when we hit step 3. It's the massive disruption effort and the exponential growth that it brings. The fourth step is dematerialization, where we move away from having tangible media and content that we can touch into having it online. The fifth step is demonetization, where we step away from writing checks and actually paying people cash for money into having automatic billing services that come out either of our bank accounts or our credit card systems. And the final step is democratization, where services become open to all. So here, we can see in the table on the right a few services that have completely been disrupted over the past 20 years. The first of which is music. The music industry went from having CDs, cassettes, and vinyls, now to streaming online. Most people stream their music online, and for a lot of them, it's also free. Spotify has a free service. So you can just think about how we went from digitizing music all the way to democratizing access to music in a completely free environment. We spoke about cable, moving from cable services to Netflix or the Amazon Primes of the world, but even our travel agencies, right? We had establishments where people would go in and actually book travel, and now we do that online, and we went from paper tickets to having online plane tickets in our telephones. But it's not just about consumer services and consumer ease. We see that there's also disruption on professional services. For instance, law firms. We went from having attorneys that we'd always call into many attorneys now having templated formats on platforms such as LegalZoom, where one can buy a template and pay for customization of a template rather than a full-on draft. The knowledge industry, from moving from the Encyclopedia Britannica, for those who remember living in the 80s and 90s, all the way to now having Wikipedia or Google or doing all our searches online. Same with our education services, going from universities to Coursera and so on and so forth. But there's one industry that has hardly been disrupted so far, and that's the healthcare industry. And so it begs the question, will AI be the catalyst for healthcare disruption? Right? And we'll leave that question for now, and probably a good question for everyone to ponder as we go through this presentation. So on the next slide, what we see here is the potential impact of artificial intelligence on the different stakeholders within the healthcare industry. And what's fascinating about this is as we go and we study the healthcare sector and the impact of artificial intelligence, what really stands out to us is that it's not so much about the impact of artificial intelligence as it is about the impact of assisted intelligence, right? So it's a twist on AI here. And the reason that it's assisted intelligence is that it's not meant to replace the physician, not meant to replace the provider or the healthcare industry players, but rather assist them in their ability to deliver healthcare services. So let's focus on that assisted intelligence within the healthcare sector. And so some of the key stakeholders here and the impact of assisted intelligence, for instance, industry players, the manufacturers of the world, whether they're manufacturing medical devices or pharmaceutical products, they can probably have faster product innovation with assisted intelligence. On the provider side, we can talk about faster diagnosis for patients, delivering it faster. On the physician side, delivering diagnostics with fewer errors and increased accuracy. Again, this is a safety net to, like the assisted intelligence, to ensure that we're delivering good quality and highly accurate results to our patients. On the payer side, greater efficiency and cost reduction, clearly a key factor there for payers. On the patient side, faster access to care. And for policymakers, especially those operating in emerging markets and in Latin America, broadening the access to care, right? Enabling care for more people. So on that note, Chris, I'd like to bring you back in and ask you, in your recent projects, has there been any specific area that really stands out to you where AI, assisted intelligence, could play a role?
Yeah, I think there are a number of areas. One that stands out is faster diagnostics. For instance, on scans, images, MRIs, you could see the emergence of processing capabilities, quickly diagnosing what is on the image or the X-ray or the scan, and also improving the accuracy. Once you get the entire database of all images that has been processed through a particular type of device. So that's just one example that stands out in this concept of assisted AI.
Brilliant. Thank you, Chris. So moving on to the next slide, we're just going to recap quickly the impact of these unstoppable forces on healthcare. And as Chris mentioned, the impact of population growth, that's further compounded by a demographic shift to an elderly population. The impact of technology, disruption along the lines of multiple industries, and possibly the entrance of artificial or assisted intelligence within the healthcare space as a major unstoppable force of change moving forward. So on that note, I'm going to pass it back to you, Abel, to inform the audience of our report and also a quick poll question.
Sounds good. Thanks, Guillaume. Let's move on over here. Okay, so this is the cover of the report. The unstoppable forces are actually covered in greater detail in this particular report. And a lot of the other data, of course, that's going to be in this webinar comes from this report as well. Basically, what the purpose of it is to give that overarching view of the marketplace and the landscape with these forces that are changing the marketplace, to give that sort of big picture understanding. And then the report, what it goes into a breakdown, first of Latin America in general with data on hospital infrastructure. And then it goes into each specific country of the countries that we decided to focus on, which are the major hospital markets in the region. So you're going to find market data in this report on Argentina, Brazil, Colombia, Chile, Mexico, Peru, and Central America, aggregated with all the different countries. So what you're going to see there is going to be hospital size, equipment penetration, trends in equipment acquisition, and a lot of other very granular data you can use to get a better understanding of the market. So if that sounds like it might be interesting to you, you can basically scan that QR code that's up there on the screen and go take a look at the website for the report, because that's going to give you a sample of the report. It's also going to let you take a look at the table of contents and give you just a greater sense of what's in it. So that's something we encourage you to do, because it may be helpful for some of your sales and marketing efforts. All right, now this brings us to our poll question we want to ask you. It's up here on the screen. Now we're going to flash it up there for you to actually answer. So you'll see the screen come up on your screen, and then you can just basically pick the response. As you can see, it's basically asking you, what category of equipment, of medical equipment, do you need data for? Because we're interested in knowing sort of some of the areas that are of interest to you, where you need the data, where your data needs are. And that helps us in terms of our content, not only with this webinar, but with our analysis blog, where we put out our newsletter every month, and we have new articles on our website. So it helps us to get some story ideas and know what to give to serve you to make it more interesting for you. All right, so we'll leave that open there. We're getting a lot of interesting responses here so far. This is helpful for us. Let's see here. I have to make sure most, if not all, folks have voted, so we can get a good sample here of what your thoughts are in this respect.
And as folks are completing this question, Abel, I just want to remind everyone this is a live webinar. It's fully live. So if you have any questions that you'd like to ask Christophe or myself, by all means, please do so. You can use the Q&A button, and we'll be getting to those at the end of the session.
That's correct. It's by all means, fire away with any questions you have specifically on, for example, of, let's say that you sell imaging equipment and you want to learn a little bit more about that. You might be able to ask us directly, and we'll be happy to try to see if we can answer your question to the best of our abilities. Okay, I think we can close the poll for now, and let's share the results so you guys can sort of see where you are and learn a little bit about yourselves as an audience. Looks like it's up there now, and the dominant category appears to be diagnostic equipment. So I guess that would mean x-rays and perhaps MRI machines and things of that nature. Although I guess, when it comes to imaging can also be diagnostic. So it can go a couple of different ways. And advanced surgical equipment, that's not surprising at all. We've had a lot of interest actually in our data that's going to be on robotic surgery systems in Latin America. And that's something that we track on a regular basis. So that doesn't surprise us. And we certainly have seen that growth really explode in Latin America with the number of hospitals that have been acquiring this $1 million equipment. It's impressive to see, and great, I think, for the patients. All right, so I think we can stop sharing that for now. Move on to the next stage of our report here. And this is going to take us now to the next section, which is on the hospital landscape and technology leaders. And for that, I'm going to turn the floor back over to Guillaume to walk us through this particular section. So, Guillaume.
Great, thank you, Bill. So on the next slide, I feel it's always fascinating when we look at globally that there's about 100,000 hospitals around the world, which is a very rounded number. And of those 100,000 hospitals worldwide, we see that about a quarter of them are in developed economies, such as the United States, Canada, Europe, Japan, South Korea, Australia, and so on. 1/4 of the world's hospitals are also in China, which is fascinating, like one single country being home to about a quarter of the world's hospitals. And just under a quarter of the world's hospitals are in Latin America. So if we make a list of the top 10 emerging markets by number of hospitals, we see that 4 countries in Latin America are in the top 10, which is fascinating. So on the next slide, we see that Latin America is home to a very large infrastructure base. We're talking about a region with just under 19,000 hospitals, 50,000 operating rooms, over 1 million physicians, and over 1 million hospital beds. So a very robust region in terms of its installed base and its demographics. However, there's some major differences between hospitals and institutions in Latin America and their counterparts in the United States or in Europe. The most notable one is the size of institutions. The average hospital in Latin America has only about 50 beds compared to around 160 in the United States or Europe. And this has a huge impact on the hospital's operations, from patient inflow to patient care, all the way to discharges, diagnostics, but also to the treatment of patients. Hospitals with fewer patient flow typically see fewer cases, fewer extreme cases, and therefore their ability to develop into specialized centers of expertise is also reduced. By the same token, they're not able to leverage their infrastructure in the same way, and therefore not able to invest in equipment and technologies in the same way as larger institutions are. So it's really important to keep an eye on this as we're looking at the region, because Latin America is composed of over 20 countries, right, that operate completely independently of one another with their unique healthcare systems. And so understanding the demographics of each region and each country is really critical in order to penetrating the market. There is one exception across Latin America, and it's the country of Chile. Chile is a relatively small country in number of hospitals. We're talking about 400 hospitals, more or less. And we see that the average hospital in Chile has over 110 beds. That's much closer to American or European standards. And what that also translates to is that Chile, not coincidentally, is also the country with the fastest adoption of technology, whether we're talking about robotic surgery systems, as some of you indicated being interested a moment ago, or whether advanced diagnostic equipment as well. The ability of hospitals to invest in infrastructure is much greater when they're able to leverage their beds and their operating rooms. So on the next slide, it becomes very important to be able to do a proper segmentation and analysis in order to target institutions correctly as a service provider. And as I mentioned earlier, Latin America is a country with over 20 regions. And then we have public and private systems operating within that, hybrid systems as well. And so growth strategies really need to be adapted and tailored into each market in order to reach the full potential of each product. Okay. So this is just an example, a highlight of what we're looking at in terms of distribution of hospital beds and operating rooms on a regional level. We see that obviously the dominance of Brazil within each, followed by Mexico, Argentina, Colombia, and Chile, the main markets. So if you're selling consumables within hospitals, we're talking about gloves, we're talking about sterilization kits, masks, and so on and so forth. Likely, these countries will dominate about 80% of your sales. However, you can't forget that there's another 15 to 20% in lower markets, smaller markets, excuse me. So on that note, Chris, why don't we take it to the next slide, and you can tell us a little bit more about equipment penetration within Latin America and what that means within segmentation.
Yeah, absolutely. So what we notice, we've broken out the technology segmentation into 5 tiers. And basically what you can see on this graphic moving from left to right is the level of technology maturity. So if we think about devices such as ultrasounds or EKGs, there's a very high penetration, but this is also the most basic technology tier. And if that's the type of device that you're looking to market and sell into the region, you may have a certain type of segmentation. So think back to the prior slide when we were talking about looking at the distribution of beds across the different countries of the region. That might be a first prism through which you're going to look at the market if that's the type of device you have. But moving along the levels of maturity, as you get into more sophisticated devices and more specialized devices, you're going to need to adapt your segmentation strategy. What's interesting is that when we get to the tech tier 2 and tech tier 1, the penetration is extremely low. It's in single digits. And that is a reflection on the earlier statistic that you were talking about, Guillaume, about the average number of hospital beds, in other words, the size of the institutions and therefore their capacity to invest. Now, another thing that it's important to note about this tech tier model is that depending on the type of hospital institution you are, if you are perhaps currently a tech tier 4 institution, and those are the types of equipments you have in your installed base, and you want to evolve your strategy and the types of patients you treat and the types of services you provide, you cannot just leapfrog to tech tier 2 or tech tier 1. And that has to do with a number of factors, but there really is a journey here, a progression. Because think about the IT investments you need to make, the capital investments you need to make, but also the training of the staff that is required to operate these different types of devices. So it is a gradual journey, and it is a progression over time. That's what we typically find. Now, how does this impact your strategy and planning? One is to look at overall at a country level, what are the most prevalent tech tiers, and that can tell you which markets to focus on depending on what type of device you're looking to sell. So, for instance, we were mentioning the case of Chile. Although it's a small market by volume and a small market in terms of number of hospitals, interestingly, it's in a very attractive market for those companies that sell devices that are associated with tech tier 2 and tech tier 1, because it has a high concentration of very large hospitals, most of which are in the capital. And so that makes for a much easier market penetration strategy. And Chile often becomes a pilot, if you will, before expanding into the rest of the region. So I don't know if there's, Guillaume, sometimes we get the question about, well, what characterizes a hospital that is a tech tier 1 hospital? Like, what are traits that you might expect to see from a hospital that is within that top tech tier?
Yeah, absolutely. Thank you, Chris. And I think it has to do with the adoption of technology, right? So their ability to invest in technology, as you rightly so mentioned. But it goes beyond that, right? In terms of their actual characteristics, what do they look like? So typically we see hospitals on the far right corner of the scale, so the tech tier 1s and tech tier 2s, typically being larger institutions, larger in the number of beds and larger in the number of operating rooms. So they have a larger patient throughput, both on the diagnostic side as well as on the surgical side. So they see more cases, more diverse cases, and more specialized cases. Not just that, but typically institutions of tech tier 1 already have implemented equipment and technologies and devices of previous technology tiers. So for instance, it's very hard to implement a robotic surgery system if you haven't already implemented an MRI or a CT scanner, right? Like, you need to have that buildup. And that buildup is the response or the result of several characteristics. First, the ability to invest in equipment, but secondly, also the ability to integrate it into the hospital systems, both from a technology and technological backbone standpoint, as well as on an HR standpoint. So the ability to integrate the equipment into the hospital operations, as well as having the physicians, the technicians, the nurses, and all the support staff available and ready, and have them already trained on how to integrate technology into their operations, right? So it's a multifaceted approach, right? It's not just about acquiring equipment and having budget, but also having the patient throughput that warrants it and justifies it, having integrated similar equipment before, and having the personnel and the HR team ready to be able to integrate that. So a fascinating, multifaceted approach.
Absolutely. Well, let's take a look at what types of equipment have seen the largest growth in the region. So this is something that we track every year, and you'll find these statistics in greater detail in the report. we've been doing this analysis for a number of years. So what's been interesting to see is that investment in installed base and medical equipment actually decelerated during the pandemic years. And that's still the case now. But having said that, there are a few categories that stand out as higher growth categories. And so you'll see here on the left-hand side, we highlighted 3 categories that are growing in the double digits. And what they all have in common is that these are devices that are associated with minimally invasive procedures. Now, if we were to go back onto the previous slide and look at the tech tier model, you would see that these are investments consistent with moving from tier 2 to from tier 4 to tier 3. So in other words, if we were to do a generalization of where Latin America finds itself as a region, it is progressing along that tech tier model. And these specifically are the categories that are seeing the highest growth. Now, another thing that a lot of hospitals realized during the pandemic is the importance of investing in technology and infrastructure to support telehealth services. And what's interesting is that we started tracking that a number of years ago, but we did it in I would almost say a rudimentary way. We just were asking hospitals, have you invested in telehealth equipment? And they would answer yes or no. And then we started realizing that does not tell the full story. So we've become a lot more granular in understanding what types of telehealth services are being offered. And as you can see on the graph on the right-hand side, there is quite a broad spectrum. There are certain types of services and medical support that lend themselves to telehealth services, including primary care, but also mental health, psychological treatment, behavioral health, some aspects of pediatrics. So a lot of the telehealth is concentrated in those types of disciplines, and you'll understand that maybe for more specialized medical treatment, whether that's urology or ear, nose, and throat, those are disciplines where you might be able to have a first consult through telehealth, but oftentimes it does require that in-person component. And so there's a ceiling as to how much telehealth can play a role in certain types of discipline. I don't know if in some of the studies we had, Guillaume, recently, especially over the past 2 years, I know that the telehealth investments have featured prominently in the discussion of some hospitals in their thinking and their strategies. Are there any that stand out either in certain countries or certain types of hospital groups?
Yes, absolutely, Chris. The Hospital Italiano de Buenos Aires, we actually had an interview with them a couple of years ago. And if I remember correctly, they went from having 8,000 teleconsultations a year to 8,000 teleconsultations a day during the height of COVID, and how then that's petered off after COVID. And but it still remains a central part to their operation. And it enables, as we were talking earlier about the technology adoption, about the disruption, and so on and so forth, it enables them to accelerate access to care in certain cases and augment general care access. So a fascinating case story, and I highly recommend looking at that. In fact, I believe that the Hospital Italiano de Buenos Aires is one of the predominant hospitals across the region in terms of technology adoption.
Yeah, absolutely. I was about to say that they're featured at the top of the list on our next slide, where we every year update the list of top technology leaders. And there you see the Hospital Italiano de Buenos Aires. There are others that are well known that you see here highlighted in green. We update this list every year. What you will find is there may be some changes in the rank ordering, but there are clear technology leaders, and they tend to cluster in each of the countries. Some of these are not surprising. Now, I will say that amongst the top 10, there are a couple of trends. One that I think is interesting is you'll find here some teaching hospitals. In other words, hospitals that are associated with university And they tend to be large institutions that have the capacity to make significant investments, even though some of them are public institutions. So it's not necessarily that it's not just private hospitals that are technology leaders and heavy investors in technology. Some public institutions are as well. So again, in the report, we not just produced a list, but also have some vignettes around the key institutions here, and also talk about the methodology of how we come up with this ranking. We're happy to discuss that more as needed.
Perfect. Chris, pardon me, just before we move on, we have an anonymous attendee that asked if the hospitals within the tier 5, so the first tier hospitals, were both public and private institutions. And yes, the tech tier model does cover both public institutions. It covers all 22 countries in that we map in Latin America. And what's really interesting is that depending on the country, we might see more public institutions in that top tech tier adoption or more private ones. And I'll give you the example of Mexico specifically. Mexico, as we saw, has a very low average of number of beds per hospital compared to other countries in the region. It's around, it's in the 40s, okay? However, again, as Christophe, you mentioned, it doesn't tell the full story, because on the private side, private institutions in Mexico tend to be much smaller than their public sector counterparts. We're talking about an average of around 15 beds on the private side compared to about 100 beds on the public side. And so this means that the hospitals typically that are able to invest, again, from an adoption standpoint, not just financial standpoint, but that know how to integrate a technology into their systems, that have the physicians on staff, that have the experience and so on and so forth, tend to be more in the public sector. So when we're talking about hospitals like Grupo Ángeles, Star Médica, Hospital Español, etc. of Mexico, there are, of the private sectors of hospital, they are typically the exception, right? They're the top tier private institutions that are much larger than most institutions, as a majority of the private sector hospitals in Mexico are much smaller and therefore have a much more difficult time adopting that technology. So to the anonymous attendee who asked that question, great question. There's a lot of texture in there, and by all means, please reach out to us through our contact information after to discuss more.
All right, I think we can move on to the next one.
All right. Well, thank you very much, Christophe. So just to fill in some blanks here, that hospital technology leaders is in the report, and it's part of what we do because we track all of this kind of information. And you can see in the report itself sort of the methodology of it. But basically, a lot of it looks at the actual equipment counts that they have of these high-tech categories like angiograms and linear accelerators and robotic surgery systems. And that sort of allowed us to create this sort of designation of the technology leaders, because we can see they have substantial amounts of equipment, and we lay it out for all the different countries that are covered in the report. So you can see the top 10 hospitals in each area, which may be very instructive for you when you're targeting a lot of your sales prospects and things of that nature, and having that understanding. And this, of course, is part of 10 years of work that we've been doing as a company to try to help medical equipment manufacturers improve their sales and marketing efforts through targeting, through market sizing for launches, market entry when they want to go into a particular country with sectors, competitor analysis, so understanding what their competitors are doing, and when, sort of a strengths, weaknesses, opportunities, and threats, and things of that nature. And of course, we also looked into very much tailored projects, because a lot of times clients will come to us with a very specific need. They have to make a decision. They have to try to understand something better in terms of applying budget or a launch or something like that. And so they need very specific strategic questions answered. And that's what we do, because we've been studying the region for so long and can have this team that can do really great primary research. We dive in there and get them their answers. That's going to help them make a move in the market. And that, of course, is what fueled this report and this webinar today. So we just wanted to make you aware of that kind of work that we do. And if something comes up that's of interest to you, or a need that you have, you can either ask it in the Q&A or contact us after, and we'd be happy to talk to you about it. We're also offering consultations as part of the webinar as well, if people are interested in something like that down the line, to get an understanding of their market needs and how we can help. There's no charge for that, and it gives us a chance to sort of find out what the needs are in the marketplace of the people in the industry. So that's also helpful for us. All right, so let's move on to our second poll question, where we still want to, of course, find out things about you and everything else. And we're going to launch that now. And as you can look at it, It basically focuses on which of the following stakeholders do you think are going to benefit most from the technological advancements that are going to be happening in the coming 5 years. So we have policymakers, healthcare providers, payers, physicians, and patients. So we'd like to see what your thoughts are as far as that's concerned. That's a very good response so far. And we're seeing it skew in a particular area, but I don't want to give it away so as to not color your responses, but that's very interesting. All right, still have a few more folks that are still responding. All right, I think that should do it. I think we can close that out now and display the results on this one. So it looks like overwhelmingly 69% opted for the patients that are going to benefit the most, which I think is probably as it should be, right? And then, of course, followed by the healthcare providers and the policymakers. So this is very interesting results. And it looks like the payers and physicians are not benefiting at all in your particular view, which is kind of an interesting take. This is helpful for us to understand, to get your view of the marketplace and such. All right, so I think we can stop sharing those results and move on to our final section, which is going to be the winning strategies. And this is sort of what we're recommending that you can do from a sales and marketing standpoint with medical equipment in Latin America. And for that, I want to turn the floor back over to Guillaume to lead us through that particular section. So, Guillaume.
Great, thank you, Abel. And just want to remind everyone that these winning strategies can be found in much greater detail in the MedTech Outlook report for 2024. What we'll be discussing on the next slide is just an overview of these. As everything else in this webinar, it is an overview. So a question came in from Aldo from Argentina about the positioning of our top 10 hospitals in Argentina. We're happy to discuss those afterwards as well after the call. Or after this webinar and go into more detail. So please, let's go into the winning strategies. What we're noticing is that from a demand standpoint, the market will remain tight for the foreseeable future. And this will result in cost constraints, both on the public side as well as the private sector. So the good enough mentality will prevail from an acquisition standpoint. And so what that means for established players in the market is that relationship building will continue to be a central part in terms of developing clients and developing relationships. Putting forward, obviously, improved outcomes, as the last poll indicated, for patients, but also the benefits of cost reduction of acquiring or implementing certain devices or equipment. From a supply standpoint, we can expect increased competitive positioning, especially from lower cost products, especially those coming in from Asia and specifically from China. And we're going to come around full circle to that in just a minute. So having a good product is obviously the centerpiece of having a good strategy. But in these tight economic conditions that we're seeing hospitals operating, clinical evidence becomes critical. So we mentioned patient outcomes. Others that are very important in order to bring forward the value of products is reliability, performance, usability, interoperability, and safety of the products. Safety both for the patients, but also for the healthcare practitioners. A critical element is also product availability. And as we saw in 19,000 hospitals across Latin America, it's very difficult to make products available everywhere all the time. And so logistics becomes a critical component for medical device and medical equipment manufacturers. Price is certainly a key component within the decision-making factor, but in recent studies that we've seen speaking to purchasers within hospitals, they don't just look at price, they often look at the quality-price ratio. So it's much more of an equation that they're taking into consideration. And in this case, what we're seeing is that players that have a diversified portfolio that can branch out to multiple areas of the hospital really have an advantage in that winning strategy to gain account-based sales that are driven by cross-selling opportunities. So definitely something to keep in mind. When introducing an innovative solution, it's critical to have clinical evidence, obviously, that supports the improved outcomes. And in that case, giving healthcare providers a hands-on experience with the products and converting them as your ambassadors is critical to driving adoption. Okay. And typically, this is a very costly method, but what we've seen in the past 3 to 4 years is more and more physicians being willing and interested in trying new technologies and adopting them, and therefore becoming the brand ambassadors for your products. In a region where 70% of the procedures are conducted in the public sector, it's critical to win tenders in order to grow the top line. And what we've seen is that companies that outperform the market typically focus on public sector and winning tenders in order to do so. And so they've developed specialized teams in order to analyze tenders and win on bids. Critical factor here, certainly in Latin America. Now, Latin America's medical space has historically been dominated by players from the United States and from Europe. That's no surprising, but COVID has put a twist to that. And what we've seen is with the onset of COVID, the entrance of many more Asian and specifically Chinese suppliers. Now, while most of these products are still on the low-cost side, there is a handful of companies out there that really do have world-class technology and that offer their solutions at a highly discounted price from the incumbents. So we certainly expect that to continue moving forward and being a major cause of disruption in the market in the coming years. So if you want to explore these and more, by all means, feel free to reach out to us or look into the report. Abel, back to you.
All righty. Thank you, Guillaume. So this brings us up to our final poll question, which we're going to launch. And this basically here is just asking you a very direct question, which is if you'd be interested in a 30-minute free consultation with our team to discuss your business strategy. And this basically is focused. It's just the opportunity to find out a little bit more about the marketplace. Because we've been studying the region for many years, there's no charge for this. We can find out what your needs and interests are, and it may give you an idea of what we can offer you in that sense and what could be helpful for you. And you never know when the two interests may have some sort of synergy there. We might be able to help you with something, answering a very thorny or difficult question. And that's usually what happens a lot of times. And of course, you know, a lot of stuff can be solved with data. If you look now, for example, right now, Guillaume was referencing Asian competitors coming in. Well, that's a competitive threat. So a lot of times competitor analysis can help gauge that threat and see which particular areas are they encroaching upon in particular sectors and know more about those companies and their operational capabilities. And that's an area where a lot of times, you know, primary research can really make a difference because you have to prepare to go against your competitors or other sorts of disruptions from a technological standpoint. And, you know, this is just a starting point. There's no obligation. It's just something for us to just talk. All right, I think that we've have everyone that was going to vote already has voted, so we can close that out. Let's move on to our next section here, which is the Q&A, and we want to try to address some of your questions. So let's take a look at those, and let's see what we have here. I usually field these, so I'm going to be posing these to the panelists, and I'd like to start us off. So we have Marcela here. The question Marcela is asking is, does the report have data on specific client profiles, such as public versus private hospitals? So they're referring to the report, obviously, we've been talking about throughout the webinar that's fueling the data that's in today's webinar. So that's the question from Marcela. So I'm not sure if Guillaume or Christophe wants to field that.
Sure. Thanks for your question, Marcela. So yes, we do look at segmentation. In fact, we segment out hospitals throughout the report by country. We do it by public versus private, also by the size of institution, by ranking of beds, so 0 to 5, 6 to 10, and so on and so forth. So you can see what are the largest hospitals and maybe target them. But our really the report is also fueled by our database called HospiScope, where we actually call and update hospital profiles. We update over 10,000 hospital profiles per year, where we literally call up the hospitals to ask about their infrastructure. So certainly a combination of either the report or the HospiScope data set may be of interest to you, Marcela, and happy to discuss that with you online afterwards.
Okay, and so we have another question that's very practical from Leandro, and this is, can the data set be used to identify future sales opportunities? Well, makes sense. We want to have a practical purpose for this.
Absolutely. So yeah, what we've done in the past, and I think, Chris, you can speak to this as well. We've done propensity model analysis, so analyzing hospitals that have a certain equipment today and identifying their profile in order to understand or identify specific hospitals that have the right profile but don't yet have the equipment. And this gives our clients a short list of hospitals that they could literally go knocking on their door and discuss potential solutions. Chris, I don't know if you have anything to add to that.
Yeah, I just add the nuance that doing that type of analysis yields two types of segments. One is the hospitals that today already purchase that type of equipment. And so you know for a fact that they are a potential buyer. And then the second type of hospital it yields is based on the tech tier model, is hospitals that we predict may soon want to invest in that type of equipment. And so that's more of a future growth potential, but where you can gain early mover advantage.
Okay, and we have another question from Alina. You say that you track data. I've been doing this for a long time. So can we use your data to get new clients? I think so, but
I certainly hope so. We do have case studies that support that. Back to this propensity model analysis, we recently had a client tell us that as a result of it, they've been able to sell a few equipments. These are in the $100,000 range. So any sale is welcome. But maybe adding to that, Alina, the one thing that also our clients use this data for is uncovering blind spots. So, supposing in Mexico, we're talking about a market of around 3,200 hospitals, if my memory serves me right. It's very difficult for any one company to be able to reach out to 3,200 hospitals at any given time. So it obviously use of distributors and secondary distributors and so on, but using the data set to corroborate against the CRM, against the ERP to understand what are potential blind spots, what hospitals exist that your Salesforce might not be getting to is critical. And in the analysis that we've done of this sort, we've seen that our clients typically have, even the larger ones, between a 20 and 25% blind spot. So hospitals that they're not going to see, but do have the potential for acquiring specific products.
All right. Now we have another question from Hector, and he's asking about how probably does LATAM adopt China's tendency to develop hospitals, and what could be the timeline to see this as a firm example in the region?
Sure, absolutely. Thanks, Hector. Great question. Certainly there's a growth of institutions in the region in terms of the number of institutions, but I don't think anyone can build in hospitals quite as quickly as China can. And we saw that during COVID, that they were, assembling 200-bed hospitals within, I think it was 8 days, fully staffed and fully equipped. We definitely don't see that happening in Latin America. What we do see, though, is much more focus on driving cost effectiveness and efficiency of the current infrastructure. So if you go back to the winning strategies that we were talking about, you can see that many are intimately tied with, patient outcomes, cost reduction, and driving efficiency. And that's really a position that we see Latin America in right now. Again,
Okay.
as we spoke about, and Christophe, maybe you have some insight on this as well, it's not just about price. It's not just about offering the lowest cost product. It is about understanding that quality price ratio and the nuances around that.
I would say,
notably having product availability. Please.
Yeah, I would say it's quality, price, and availability also is an important factor.
Absolutely.
And would you say that, just to add to this, that among our capabilities, we could probably talk to a lot of the actual hospitals to find out their attitudes in terms of what they're looking for and provide that kind of data to a client as a custom study? Wouldn't that be something possible that would help really uncover the mindset of the clients for the medical equipment folks?
Yeah, totally, Bill. You're absolutely right, and we do that regularly throughout the year. As mentioned, we update over 10,000 hospital profiles. We do obviously medical outreach. We speak to key opinion leaders, and I see a question coming in here from an anonymous attendee about data on key top opinion leaders. We have KOLs, obviously, as we develop our research, we need to speak to KOLs, but also digital opinion leaders that we reach out to. So the ones that are really moving the needle online and through different forms of social media. So we have ways to get those lists and to see what's going on there. So yes, totally, all of that is absolutely possible.
Yeah, what I think that's interesting about that too is the ability to scale that up, because I'm sure that the people are on this call that have a great understanding already of the market, but they know the market from the perspective of their client and prospects, but not perhaps on that wider scale. So if you look at a country like Mexico, it has what, 3,600 hospitals or more. So that's probably not going to be in all 3,600 are probably not going to be in a given company CRM with all the contacts for that. So to get a large swath of that and understand their attitudes probably can help you expand your your range in terms of prospects themselves and your understanding of what everybody wants in that particular market.
Terrific. Absolutely, Bill. I think
We
we're
have
at the top of the hour. I do see another question from Kelly coming in. Kelly, if it's okay with you, I'm just going to send you a quick email after this call, and we can maybe discuss oncology offline, just to be respectful of everybody's time here today. But I do want to invite you, please, on the next slide, Abel, to stay in touch. You have our contact information here. My email's right there. Christophe is as well. Please feel free to reach out to us to continue engaging and to continue the conversation. We love this type of stuff. We'd love to talk about healthcare and healthcare infrastructure, probably as much as you do. So it's always a pleasure. Thank you all for attending. And Abel, back to you to wrap up.
All righty. Well, I guess that pretty much should do it for us. So we want to thank you for taking the time to join us. Once again, there's the report with the QR code. And we hope that some of the insights that we've shared today have been helpful. There's obviously more in that report. You can go on the website and take a look to see what's in there. Or if you want to talk to us more directly about the information that we have, by all means, that 30-minute consultation stands. You can actually reach out to Guillaume or to Christophe to arrange for that, and they'd be happy to talk to you as far as that's concerned. Also, to keep an eye out for the materials. Within a couple of days, we'll send you this presentation as well as the video of this webinar, just to be as a resource for you to look at the data, and hopefully that'll help you just develop a deeper understanding of the market and improve your sales and marketing efforts in the region. So we wish you continued success with that. Thanks once again for joining us, and we hope that you have a wonderful day. Thank you.